countries of the European region have made a joint commitment to their populations and the world to eliminate measles and rubella. Real progress has been made and regional elimination is within reach, but business as usual will not get the remaining countries across the line. Nearly there is simply not good enough. Leading experts were brought together by the London School of Hygiene and Tropical Medicine and WHO Regional Office for Europe in September 2016 to discuss lessons learnt and the way forward. These experts share their insights and advice to policymakers across the region to speed up action and to get the job done once and for all.
Did you have measles when you were a child?
I did have measles as a child.
Well, yeah, so did I. I mean, we all had measles as children, and plenty of my contemporaries had a rough time with it, and some of them will have died. We completely forget that background, and you have to talk to grandparents to remember what a scourge measles was.
In the developing world, where about 1 in 100 or 1 in 200 people die, most families know that measles is a killer. And so really it's out of the public eye, particularly now that we've controlled most cases, that this is a really dangerous disease which does kill children.
We do think that there are some countries within Europe that are sitting on a powder keg of susceptible populations. They just have been lucky in not having had a big outbreak yet.
Measles is so highly infectious that you end up having measles cases in all populations that have not been reached by health services, by immunization services. So it's a good marker of the framework of Sustainable Development Goal, which central theme is no one should be left behind. By preventing diseases, you reduce the likelihood of using the antibiotics that we have, and therefore you reduce the overall antimicrobial resistance.
We've known for many years, from the 1960s, from the first clinical trials that were done with measles vaccines, that in a small proportion of children, possibly 1 in 1,000, 1 in 2,000, it can cause fever sufficiently high to be associated with febrile convulsions. This is a transient side effect from which the infant recovers very quickly and infinitely preferable to having the wild measles infection.
The good news is that the vaccine we have available, the trivalent vaccine, also contains a rubella component, and that works very well.
One of the reasons why we look for high coverage is to maintain population immunity. And so for different vaccines and different diseases, the herd immunity is at different levels. And so generally for measles, it's 95%. So very high coverage is needed to stop the person-to-person transmission of the measles virus. Rubella is luckily a little bit less infectious, so we don't need as high a coverage to maintain that population immunity.
Certain groups in the population are just have less contact with health services for whatever reason, and we need to get and find them and vaccinate them in places and times that are convenient to them.
There'll be populations and subgroups of populations that will not vaccinate for different reasons, so it's important to figure out what those reasons are before deciding what strategies to use.
Rubella and measles elimination is feasible because America has demonstrated it.
I think we've seen a lot of progress in the last couple of years, and we feel that we're on a trajectory that makes elimination possible very soon.
It will take an intersectoral collaboration